Hi, my name is Bethany Wax, RN, and this is my patient JW. And I'm just going to let you see my proctor here. This is Mr. Jack Smith. Okay. Would perform hand hygiene. And hello, sir. How are you today?
I'm good.
My name is Bethany Wax. I'm going to be taking care of you and doing an assessment on you today.
Okay.
Looking at the skin on the upper extremities is normal for patient's ethnicity, warm, smooth, good skin turgor. Can you take your socks off, please? The skin on the lower extremities is normal for patient's ethnicity, warm, a little dry, good skin turgor. Hair is normal distribution for patient's age and gender. No edema, no abnormal varicosities. I'm just looking for any lesions. Just a small 2 millimeter straight lesion on the right lower leg. Okay. You take a look at your fingernails. They're pink. Capillary refill is less than 3 seconds. The fingernails are normal thickness. No clubbing, normal contour, normal adherence to the nail bed. And toenails are pink. Capillary refill is less than 3 seconds bilaterally. Normal thickness, no clubbing, normal contour, normal adherence to the nail bed. Okay. On inspection of the head, it's normal size, normal shape, it's symmetrical. Inspection of the hair is thick. Do you have any tenderness on your scalp?
No.
No lesions, normal distribution. I'm just gonna touch your head. Tell me if there's any tenderness.
No.
Okay. No swelling of the paranasal sinuses. No lesions or bumps or anything abnormal there. Can you open your mouth? The TMJ is normal, no crepitus. Can you clench your teeth tight and put your chin out? Can you put your jaw out? Like your teeth out. There we go. And back in. To the left and to the right. Okay. Good. Can you close your eyes tightly against my resistance and open your eyes wide? Smile. Frown. Puff your cheeks out and act like you're kissing. Okay? We're just assessing some cranial nerves there. I'm gonna test the sensation on your face, so I need you to close your eyes, and I just have a cotton ball, and I'm gonna touch you. You tell me when you can feel it.
Feel it. Feel it. Feel. Yep. Yes. Yes.
Now, let me see your hand just a second. This is gonna be sharp, and this is dull. I'm gonna do the same thing on your face for sensation of pain. Okay, so if you close your eyes, just tell me when you either say dull or sharp.
Dull. Dull. Sharp. Dull. Dull. Dull.
Okay. Good job. Okay. Now we're gonna move on to your eyes. This is a long distance chart. We're gonna test it from about 6 feet. So you tell me the lowest line that you can see.
The bottom line, LTFPH.
Can you cover your left eye.
Read it again.
Yes.
LTFPH.
And cover your other eye.
LTFPH.
Normal 20/20 vision bilaterally. Now that was the Snellen chart. This is the Rosenbaum chart for close-up. We're going to hold it 14 inches away from your eye and just read the lowest one that you can. Cover up one of your eyes and read the lowest one you can.
937820.
Okay, and on the other side,
937820.
about 20/25 vision bilaterally close up. Okay, I'm going to test your peripheral vision, so you tell me when you can start to see my fingers.
You can start to see it.
And on the other side,
You can see it.
normal peripheral vision. Okay, I'm going to test some cranial nerves again. Just follow my finger. Okay, normal eye movements. I'm going to check your eye reflex. So just look normal, and I'm going to just test it with a cotton ball. Okay, that's normal. I'm just going to cover up your eyes. This is the cover test. Just look forward normally. Okay, normal results there. On inspection, the eyebrows are symmetrical, normal hair distribution. The eyelashes, normal hair distribution and symmetrical. The eyelids are not swollen, they're symmetrical. The sclera is white. Conjunctiva is pink. The iris has sharp borders. The cornea is clear. The lacrimal apparatus is not swollen. No tears. The lacrimal sac is not swollen. The anterior body is not swollen. The position of the globe is normal. I'm going to check the pupils. So, your eyes. Looks like pupil size is 3 millimeters right now. I'm going to test with light in your eye, okay? You follow my finger? Okay. So the pupils went from about 3 millimeters to 2 millimeters, equal and round and reactive to light. Now with the ophthalmoscope, we'll check the inside of the eyes. The lens is clear. The red reflex is present. On the left side, let me look at the other side as well. The color of the arteries and veins are dark and red pink. The arteriovenous crossings have normal characteristics. Just gonna move on to the ears. The auricles are no lesions. Do you have any tenderness behind your ears?
No.
Tenderness in the mastoid area?
No.
Okay. The external meatus is normal, no lesions. The ear canal is pink. The tympanic membrane is clear, mobile, and intact. The umbo, malleolus, pars tensa, and pars flaccida are normal orientation on the left side. And moving to the right, the external meatus is normal. The ear canal is pink. And the tympanic membrane is clear, mobile, and intact. Okay. I am going to do a whisper test, so I'm going to whisper and you tell me the 3 things that I say.
157. QCL.
Whisper test is normal. I'm going to do, it's called a Weber test. I'm going to put this on the top of your head and you tell me if you hear one side it louder in one ear than the other.
I think about the same.
It's normal finding. Now I'm going to do, it's called the rind test. I'm going to put this on the bone behind your ear. You tell me when you can't hear it anymore, and then I'm going to put it outside your ear, and you tell me when you can't hear it anymore.
Can't hear anymore. Can't hear anymore.
I'm going to do the same thing on the other side.
Fail to hear anymore. Can't hear anymore.
Normal findings because the air conduction is greater than the bone conduction. Okay, moving on to the nose. The nose is normal size and shape. It is symmetric. I'm going to look inside the nose. It's pink. The septum is midline and intact. The terminates are intact, no swelling, and no drainage on either side bilaterally. Okay, can you close your mouth and include one side of your nose and breathe in? Okay, and the other side. Okay, both sides of the nose are patent. Okay, now if you could close your eyes and occlude one side of your nose and tell me what you smell.
Smells like coffee.
Okay. And do the other side.
Smells like, let's see. Man, maybe mint.
Yes. Okay. I'm gonna move down to the mouth. The lips are pink and moist. You can just open your mouth a little. The tongue is pink, midline. The buccal mucosa is pink. Let me see your teeth. The teeth are intact, no signs of cavities. Can you lift your tongue up? The labial and lingual frenulum are intact. The Wharton's and Stinson's ducts are not swollen or inflamed. Okay. I'm gonna put this on your tongue. Can you say ah? The palate has a normal rise. The uvula is midline and intact. Can you stick your tongue out for me? And stick it to the left, right, up, down. Okay, good. Can you swallow for me? Okay. And we just want to test the gag reflex. Can you say a sentence for me?
Sky is blue.
The swallowing was good. The speaking is good. The gag reflex was intact. Okay. Now I'm going to move to the neck. I'm going to palpate the cervical spinous processes. They are normal and the muscles appear normal in that area. The neck is symmetrical. The trachea is midline. Okay. I'm going to palpate for some lymph nodes. The pre-auricular, post-auricular, submental, sublingual, tonsillar, occipital, the anterior, posterior, and deep cervical chains. No lymph nodes were swollen. Okay. The carotid arteries, we don't see any abnormal pulsations on inspection. On palpation, the carotid artery is 2+ bilaterally. On auscultation, there's no bruits or hums over the carotid arteries. Okay. We'll look for the thyroid gland. Can you just take a sip? The thyroid gland is midline, no swelling. And no abnormal sounds over the thyroid. Okay. The next thing we're going to do is the lungs. Can you remove your shirt, please? The thoracic area is symmetric and normal. The skin is normal for a patient's ethnicity. Warm. No extra lung movements. Can you say 99?
99.
Again?
99. 99. 99. 99. 99. 99.
Normal tactile fremitus. Gonna percuss. You take a deep breath. On percussion, the lungs are resonant. The diaphragmatic expansion is about 3 centimeters. I'm gonna put my hands here, and can you take a deep breath? In and out a couple times. The diaphragmatic expansion is symmetrical. And listen to your lung sounds. Take a deep breath every time I move in and out. Same thing on your back. Normal lung sounds. Vesicular, no extra sounds or abnormal sounds like wheezes. Okay. Now moving on to the cardiovascular. Don't feel any murmurs. PMI. Aortic, pulmonic, Erb's point, tricuspid, and mitral. S1 and S2 heard, no extra heart sounds. I'm gonna feel some arteries, temporal, brachial, radial, popliteal, posterior tibial, dorsalis pedis, all 2+ bilaterally. Okay, if you would just lay down, I'm gonna inspect the abdomen. The abdomen is symmetrical. No abnormal hernias or bulges. Auscultate. Normal bowel sounds in all 4 quadrants. I'm gonna listen to the arteries, the iliac. Renal. roots or humps in those arteries. The belly button is midline and symmetrical. Hit a percuss. Tympanic and normal. Percussing for the spleen. About 6 millimeters below the mid-axillary line and 3 below the mid-sternal line. Pressing for the spleen. It's tympanic, so no spleen enlargement. Palpation, there's no spleen enlargement. No liver enlargement. No abnormal masses. Can you turn on your side? And no kidney, and the kidneys are not palpable, so they're not enlarged. You can sit on the side. We're gonna move on to musculoskeletal. Okay. We're gonna do a lot of range of motion and strength. So, starting with, I'm going to just inspect all your muscles and bones in the neck. They look symmetrical, shoulders symmetrical. Arms, muscular, symmetrical. The hands and fingers. The back, the contour and musculature, everything symmetrical on the back. The legs, good musculature. The knees, legs, ankles, feet, all symmetrical, good muscle tone. Can you stand up? I'm just gonna look at your hips. The hips are symmetrical, good muscle tone, contour. Okay, you can sit back down. All right. And so for the range of motion on your neck, if you just follow my movements, back to one shoulder, other, can you turn it? Okay, now against resistance, all of those. To the left, to the right, the front, back, to the side. Okay. Are you having any pain in your neck? No? All right. And now moving to the shoulders. Can you put your hands up? And then behind you, out to the side. Can you touch your shoulder blades? Put an L like this, and down, and back up. Okay, good range of motion. Now, can you shrug your shoulders against resistance? Okay, you put your arms up like this, and try to push me down. Okay, and now try to push up and down. Okay, good. And your elbows can go like this, and now down. Can you flip them over and back? Okay, and we already tested the strength on those. We'll move to your knees. Can you put your knees up and back down? Okay, and then against my resistance. Okay, and back down. Okay, Can you move your ankles to the floor? And back up. Can you go to the left? Or in and then back out? Okay, and then against my resistance, can you press up? Press back down. Okay, good. Okay, if you would stand up, we're gonna go to your hips. So can you bend back, bend to the left, to the right? Can you twist? Okay, and then if you could touch your toes and then come up slowly. Okay, good range of motion on the back and the hips. All right. Let's see. If you could just take a normal walk across the room and back. Okay. And now that was a normal gait. Now this time, can you walk heel to toe like you're going on a balance beam across and back? Good job. Normal gait that way as well. And in the back, when we bent over, there was no signs of scoliosis. Okay. We're gonna do what's called the Romberg test. I need you to put your feet together, your hands at your sides, and just close your eyes and stand still. No abnormal movements. Now can you put your hands just straight in front of you, keeping your eyes closed. No abnormal drift. Now I'm just gonna press down on your hands, just let them come back up. Still hold them down. Okay? Good job. You can open your eyes. That was normal. Okay? So, you can sit down. All right. So, if you could open one of your hands and close your eyes, I'm going to put something in your hand and you tell me what this is. Stereognosis.
Coin. Dime.
Okay, yes. Okay, open your other hand.
Quarter.
Yes. Stereognosis is normal. Graphesthesis, I'm going to write a number in your hand and you tell me what it is.
2.
Yes. And do it on your other hand.
5.
Yes. So that is normal as well. The graphesthesis. Okay. Just how I tested your feeling, your sensation in your face, I'm going to do that over your whole body. So you just tell me, with your eyes closed, just tell me when you feel something.
Feel. 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 Feel it. Feel it. Feel it. Feel. 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 Yep. Yes. 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 Yes.
Okay. Good sensation throughout the body. We're going to do the same thing with the sharp and dull that we did earlier. Okay, just tell me if it's sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp.
Good. Now we're going to do the same thing but with vibration. So you tell me if you feel the vibration.
Yes. No. No. Yes. 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 No.
gonna do a position sense. So if I can see your hand, and I'm gonna move. This is if you open your eyes. This is up and this is down. Okay, close your eyes and you tell me what I'm doing.
Down. Up.
The other hand.
Up. Down.
Okay, I'm gonna do the same thing with your toes.
Down. Up. Down. Up.
Okay. Okay. And I'm gonna do your reflexes. Okay. So the brachial. Tricep. Brachiocephalic. Popliteal. And the ankle jerk. All normal reflexes. The patient is in excellent health. No real abnormalities to report. He was very healthy. Thank you so much.